Hello, everyone. I'm glad you could join us tonight. I am Candy Lamar. I am the host for this session, and Connie Glover is our tech person. So if we have any tech issues, hopefully Connie can resolve those for us. So again, super excited to be here tonight, and I certainly see a lot of folks who are repeat attendees from earlier into today. So thanks for continuing to join the sessions. It is my great pleasure to introduce Mary Ellen McKnight. She is going to be one of the presenters tonight, and I'll let her introduce herself and get started. And please be sure, if you have questions or anything, don't hesitate to put those in chat, and we'll make sure we get to those questions throughout the presentation. So with that, I'll turn it over to you, Mary Ellen.
Thank you, Candy. Hi, everybody. My name is Mary Ellen McKnight. I am the Medical Coordination Director for Case Camp here in Delaware. And Dr. K had a previous appointment, so hopefully she'll be able to join us a little bit later on, but I told her we could handle it. My coworker, Teresa Scarfo, is going to be helping me to facilitate the roundtable. And we are both from Case Camp. So, you know, the roundtable was always one of my favorite parts of conference because well, actually, to be honest with you, Teresa and I would write questions all throughout the year and bring them to conference. That's what we would do because we wanted to get everybody else's opinion. So I think that the beauty of the roundtable is that it can be very informative and it's a safe place. You can ask any questions you need to. And this is a way of sharing ideas and navigating through what have been some really difficult times. And, you know, as Dr. Raffi was saying, we don't know what the future is going to hold, but I do know that we're in it together. So please, this is your roundtable. This is your time to share some ideas and questions. So one of the first things I guess I just kind of wanted to kick it off with was, what are some things that you're concerned about with the upcoming camp session? What are some maybe worries that you have or questions you're just not quite sure how to navigate? Or what are your concerns with the upcoming camp season?
So I'll jump in, break the ice a little bit, maybe. First, I'll just say, for those who don't know me and know my camp, we serve kids with a variety of medical conditions and disabilities, not just cancer. So we're a little different from most COCA camps. And we did operate last summer, but we did not operate. We did not accept campers who were on the CDC's high risk list unless they were vaccinated. We do serve adults as well. So we were able to serve a number of campers last summer, even those who may have been on the high risk list if they were already vaccinated. But even with that, we sometimes struggled to fill our sessions. And with our school year programming that we're doing now, we still sometimes struggle to fill our sessions. You know, things maybe work out according to some plan that's bigger than anything I could put together, because we also have had difficulty recruiting staff and volunteers, including medical staff. And if we had more campers, we wouldn't have the staff that we need to appropriately take care of them. So we've had what we needed to meet the needs of those that we were able to serve, but we continue to struggle to figure out how do we get back to capacity with all of those components, because it takes all of them. You got to have the medical staff, you got to have the counselor staff, so that you can have the campers, and then you have to make it so that everybody trusts that you're going to be able to do it safely. So I think those are the big issues that we've been facing and continue to try to figure out how to best address.
I also feel like Teresa Scarfo, I work with Mary Ellen. I feel as though we're going to constantly be revamping all of our policies around immunizations because things are changing all the time. And, do we mandate that our campers are vaccinated now, that it's approved, even though, maybe their doctors won't approve it? And then what does that look like with your staff being vaccinated or not vaccinated in person versus virtual? And we didn't have a lot of campers in person last year either.
Yeah, we actually did a hybrid last year. We did 2 days face-to-face, and even then it was just the afternoon. And then the rest was virtual. Even our virtual numbers were down from 2020. And, I get it. Maybe I don't know whether it kind of gave people the thought that, what, let's just, until we're back in person, let's just have a family vacation or what have you, which is fine and great. But I know our numbers were down. And so it's always hard to plan staffing, right? When you don't know how many kids are coming. But I kind of felt like the ones that had committed to come in person that we had planned for actually started falling off like the day before the in-person event. So that let's just say we were very well staffed for the in-person events. But it was difficult because, there were people that needed transportation, and not only did we have to find staff that was vaccinated, but then we had to find our drivers, and some of our drivers weren't vaccinated. So it was kind of a perpetual roller coaster that we were on, and camp is we always figure it out. It always works. We always figure it out. And I think everybody had a great time, but it was difficult. It was very difficult.
In that sense of just always figuring things out, like that, I think is just how camp people do it. And usually we're able to come up with ways to make it work and still be safe and successful. We had a family retreat a couple of weekends ago that we were already feeling pretty crunched on staff, and that was just activities to lead activities. And we had 4 no-shows.
Wow.
While we were already short. And the way they've been doing family retreats is that we have been having one family at a time at each activity so that the families are socially distanced from one another. And we've done that throughout the pandemic, and it's been successful. And even with all of our in-person summer camp sessions last summer, we did not have any cases of COVID among camper. We feel very good about the protocols we've put in place and the successes we've had. But with this weekend, a couple of weekends ago, we said, okay, we don't have enough staff to run 10, and we had 10 families. We don't have enough staff to run 10 activities simultaneously. How would you feel about being paired up with another family? And, and everybody said, yeah, we'll do that. We'll wear masks, we'll do, whatever. And most of the families were vaccinated as well. But they did it. And then the feedback that we got was, this was the next step we needed to take to feel like we're getting back to normal. So we're glad this happened. We're glad we got to, network with another family and all of that. So I think being open to the silver linings, even when we have those challenges, is a really important part. And I didn't say this earlier, but again, for those of you who don't know me, I'm also a clinical psychologist. So I'm not a physician, I'm not a nurse. Mine is, an allied health kind of perspective. But I did my training in PD-HEMONC before deciding to go back into the camp world full time. So I am always attuned to those issues. So, what is the mental health effect of what's going on? And I think we all know that the pandemic has had its toll on lots and lots of folks. So getting back to that sense of normalcy, I think, is huge. Every little step we can take.
Brandon, can you talk a little bit about how you ran your family programs. To me, that's actually when I think about the camp programs, I feel like when you're with your campers and your age specific groups, you can control it a little bit more. But then when you bring in the whole family, and how do you provide activities, but still ensure that connection that they come to camp for with other families, but still keep them safe. And then also, I think the other question that I really think about is, obviously, as we move forward, we've actually, told our community that they will need to have COVID vaccines. Obviously, in the family camp programs, you're not going to be able to enforce that because of the younger children. So I'd love to hear more about, for me personally, the family programs, if that's something that anybody else is interested in.
I'm certainly happy to share what we've done. And we did set up, so basically we've limited to 10 families at a time. Each have their own cabin space that's their own, no sharing of bathrooms, nothing like that. At our family retreats, the families are in charge of their own medication management. So we don't have it turned into the healthcare center, or that, like they keep it in their cabin and they do everything themselves with medication. But then until this last retreat, we've had 10 activities running simultaneously so that each family could be at one of those activities. Meals were all in the same place, but everybody had an assigned table. We served to the table. So it was family style, but we served the bowls, platters, etc., to the tables, and then drinks and everything. So once the family is seated, they don't get up until they're done, or if they have to go to the bathroom, they wear a mask getting to the bathroom, that sort of thing. Like it is in most restaurants, essentially, is how that was. And the feedback that we were getting from families was, so those who had come to family retreats prior, where there was a lot of networking, a lot of opportunities for, those families said, we miss that. We can't wait till we can get that again. But this was such a great just getaway for our family. We've been cooped up in the house and not going anywhere, and just to be able to get out and do these activities and do it together as a family has been just a real blessing. So that we got that kind of feedback consistently as we've been able to allow more interaction, and especially this last retreat. People are really digging on that, and they want to get to more of that. But even with the greater restrictions and less networking, the families just felt like it was well worth the time. Some of them said, we were going to take our first vacation in 5 years before the pandemic hit, and we didn't get to take it, and so this is our vacation. And it's just I think we have to remind ourselves that we have this ideal of what it can be and what it should be. But even if we have to take it back a step or two, that doesn't mean it's not still an amazing opportunity, for families and for campers, aside from families. I don't know if I'm really answering the questions that you have. I'm just kind of talking.
Yeah, no, I think that was good. So all activities were contained within the family unit.
Right.
And did you have any issues with parents wanting to mix at night after the kids were in bed, or anything like that?
No, I mean, everybody has been very, respectful of the parameters that we put in place, and understood why, and the safety for themselves and their families. So we really hadn't run into any of that in any of that. And I guess I'd have to count to be sure, but I think we've done like 10 or 12 since the pandemic started.
And you just rotate who gets to come? Do you have waiting lists?
Yes. And, one of the things that I'll say that we didn't, so when we started this school year, kind of reset the season with the school year. And I said, we had some families, we had one family that came 3 times last year, which is great for them that they wanted to, but then are there other families who are missing out because of that? And, and they were always a wait list family, that they didn't automatically get a slot, but they were like, hey, if you have any openings. And I said, for those families who came 2 or 3 times last season, let's put them on the wait list to begin with. Let's not give them any of the slots, so that we give those opportunities for other families to get to come in. And we've had some families that it's their first time to come to camp at all during this, and then once they've had that experience, some of the ones last year sent their kids for a week last summer, even in the midst of a pandemic. And I think the opportunity to build that trust and let them see the program, the facilities, meet the staff, is just a huge bonus for those retreats, no matter how you are running them.
Thank you.
Sure.
I can mention as well, my name's Kelly and I'm from Camp Good Times, which is in Vancouver, BC, Canada. And we did a presentation just earlier today. I don't know who saw it, but we ran what sounds like almost the same sort of program as you did, a lot of the same things. And I was actually very shocked to see how many families really did follow all of our guidelines, even though for our community guidelines had just started to open up right when we were starting camp. And we decided to keep our guidelines the same, even though the community was more lenient. And I was really shocked to see how many people followed the guidelines. I think out of about 60 to 70 families, we said maybe 4 to 5-ish were a little like pushed back a little bit on the guidelines, but otherwise everyone else stayed in their own family bubble and didn't really interact with each other. Having said that, I was just thinking of, because guidelines were changing right as we were opening for the summer, we had initially planned to only have families interacting with themselves and no one else, the same sort of format, going to an activity by themselves and creating a schedule where we would sort of know where they were going at all times. But as things opened up in our community, we were actually able to have some outdoor distanced community activities. So we would like set picnic tables up at least sort of 3 to 4 meters away from each other. And then we would have, say, like a paint night where we would have all the supplies on the tables and the families could sit at their picnic tables, and then they were appropriately distanced, but they could still socially interact with each other as much as they wanted. And we had like a movie night, an outdoor movie night where we did the same thing. We set the chairs up in appropriate places and then they could all watch the outdoor movie together. And we did a campfire as well in the same way. We had them all seated in their family bubbles, appropriate distance from each other. So there, we did find ways to sort of maximize that community, aspect of camp. And as you were mentioning a little bit, Brandon, as well, we found that I think we had about 30% of the families that came were new to camp. And they had nothing to compare it to, and they had an amazing time. Like, we had to try really hard to not let previous years overshadow the lack of this year, right? But those families that didn't know any different, they thought it was amazing and they had a really great time. And we had more families that were on treatment than we have in previous years, which was interesting. But yeah, so it was and we had lots of families that were like, we have not left our community in a year and a half. So this is the first time we're getting away, and we feel safe here. So we're coming. So it was really successful.
Hi, this is Deb Exenkamp from Camp I Hope. And have any of you started thinking about the struggle between, as more and more things open up, what's the balance between some of the restrictions that we've had to do and how we can open things up more? And where does that balance lie?
I don't know that I have the answers. I can say, again, because we were short staffed, we were forced to try, opening things up a little more by allowing a little more interaction for families. and it turned out to be great, and the feedback was great. And I feel like we're going to continue to go forward with that for our next retreat in a few weeks. One of the other things that for our respite weekend camps, which do not include the families, they are just the camper and giving the families a break. And we have been running those again this fall is when we first started those back up. We have one-to-one camper buddies. We treat each cabin group as its own like family unit and pod. And they kind of go around to activities like we have done with the families. So there is a little more exposure because they're coming from different households into that group for the weekend. But we are at least isolating those groups. So if there was some incident, we aren't having spread throughout all of camp. But we have decided that we were comfortable doing a salad bar for the first time with the respite weekends, because we have the one-to-one counselors. And so the counselors are trained that they go to the salad bar. They're trained on, how to use the utensils and, hand sanitize, like all the things. Campers don't actually touch it and serve themselves. I haven't felt comfortable opening that up to families yet because it's a lot harder to control, or all parents going to make sure that their kids go through those same protocols that we know that our counselors can make sure that the campers go through. So we're still serving a bowl of salad to the tables for the families, but it's these baby steps that we find that I don't know, we have to celebrate them, because you got to take each step to get to that overall end goal. So yeah, I don't know what the balance is, but those are some things that we've been doing.
Yeah. Well, I know, Brandon, you're in Texas like I am. So even though we still met virtually this summer, a lot of our families were kind of out and about. And so that was kind of trying to go through that kind of balance. Now, it was different this summer because there was the Delta surge when we were getting ready to have camp. But I appreciate your feedback, all of y'all.
Yeah, and and one of the other things, Deb, that I thought about earlier and I didn't say it, but I've been kind of worried sometimes because we are in Texas where we do have, try not to get too political, but we have a governor who doesn't really care about science and what the CDC says and what, and so, in terms of laws and rules about masks and about a lot of precautions, we haven't had them in Texas the same as they might be in some other states. And still, we have put precautions in place for our camp and said, well, this is what we're going to do. And, to some extent, we may sometimes be risking government action from the state because we're violating governor's orders by saying, no, we need to know this about you and, whatever, or we need you to follow this protocol. But families have been so great about doing it. They, understand, they know that their kids are at risk, that their families are at risk. And we've just really seen great cooperation and participation from families, even though our government may not say that we have to or that they have to.
We found this summer that the parents most of them were so grateful for the multi-layered strategies that we put in place to keep their campers safe. And they were so ecstatic just to be able to give their kids an opportunity. We did not do our traditional 2 full weeks of in-person. We did 1 week of virtual, 1 week of in-person, and we split the in-person week in half. So they only came for like 3 days, but it was enough that they got to reconnect. It was enough for us to get our feet wet and make sure that we could do it safely. And it was kind of almost that testing, right? Testing it out to see if we had the right things in place. I don't see that we will be lifting a lot of those safety strategies. I think if anything, maybe relaxing a little bit on some masking policies, but still continuing to mask indoors. But as I said, we have camps all year round. We are trying to go back in person for a winter camp. Numbers are starting to climb again in Wisconsin. So we will make that final decision probably in a couple weeks. But I did come out with our medical advisory committee. We did come out with a requirement that if you're coming to winter camp, or any program moving forward, COVID-19 vaccine will be required for all. We had required it for our volunteers this summer and for our staff, had recommended it for our campers, and we had 71% of age eligible campers were vaccinated for COVID-19 this summer. So we were really impressed with that. And that was just with a lot of letters that I wrote and sent out and kind of recommendations, but we did move forward with a vaccine mandate. And, if they don't want to comply with that for in-person, we will have a virtual arm that they can, work with. So, and I haven't taken too much flack for it. I had about 4 people right off the bat. One asked about religious exemption. A couple asked about medical exemptions. So again, I sent information out to those families to state that there's not really a lot of contraindications to the COVID-19 vaccine, and also influenza we're really requiring this year. So I asked them to really carefully look at the contraindications before seeking a medical exemption from their physician team.
Susie, you bring up a really good point about getting your feet wet, because that's kind of how Teresa and I looked at just the 2 short days that we had this past summer. Was, I said, well, if we're going to be doing this, COVID's not going anywhere. So we need to try to figure out, can we do this? What does it look like? And that's exactly how we felt. We felt like, well, let's get our feet wet. Let's try it for a half a day and see how it goes. And, also agree with you. We had some pretty stiff protocols in place for safety. A couple of people gave us some pushback on it, but for the most part, people were very grateful and really appreciated us going the extra mile to keep their child safe. And I also feel like it kind of set the groundwork for this coming year. I think it kind of set the foundation for, they have an idea of what next year's going to look like. So I think it was very beneficial all around.
And I think the other thing, you talked about the silver linings, and I think somebody mentioned it. We found that the smaller groups, the cohorts, were so much better for the campers that were new coming in. We didn't see that, you come into a group of 30 kids and you're the newbie. I mean, it's pretty overwhelming and anxiety producing. We just did not see that. We felt like there was a lot more cohesiveness and connectedness within those small groups. So we love that fact. And even if we continue with like the stepping up group, which is our 11 to 12-year-olds, trying to really look at how do you have smaller groups within those larger programs and continue that. But that was, I think, from a mental health perspective, I think was extremely positive. We also were surprised at the number of kids on therapy who came to camp, and again, wrote a letter to the healthcare, professionals, and asked the campers on therapy to take that and have that discussion. But there was a tremendous number of kids on therapy. We do a mix of on therapy and off therapy. And I was surprised at the number of kids on therapy and new kids on therapy that actually came to camp. So it tells you that there definitely is that need that is there. The other thing is we had to think outside the box. So we did have an outdoor medical office. I never saw one kid in the office, and we do decentralize our staff. So we had a medical staff in every cohort, which is really nice. It reduces some of that burden to the larger medical office. And this year with all the testing and stuff, it was nice to be able to disperse that a little bit. But we really had to think about other activities on campus because we didn't let people go on off campus on trips. And we found that we brought in so many more watercraft activities and water sports, and amazing. And our program coordinator, he made a slip and slide out of just, a sheet of, that plastic stuff. They did slip and slide bowling. It was like the best, cheapest thing ever. And the smiles that you saw on their faces were amazing.
Well, that is so great. You know, one of the other things that was a silver lining for us with summer camp in particular is that we developed a whole new system for check-in. And it was decentralized. You know, there were stations that parents drive in. We do temperature checks on everybody in the vehicle. We do all those things right when they drive in, and then send them directly to the cabin where they're going to check their camper in. And then we had our healthcare volunteers at the cabin on the porch, check them in on the porch, and then let them, you know, go in to make the bed and everything after they did their medical check-in. And the families loved it. It used to be, you know, you start at the dining hall and then you go either to this pavilion if you're in one of these tribes, you stay in the dining hall if you're one of these tribes, and you know, you go through station to station to station. But they loved the one-stop shopping of checking in pretty much everything at the cabin. It was a little more hectic on the logistics for healthcare volunteers to some extent, because they had to, you know, get all their medication buckets and everything to the cabin to check in instead of the one more centralized location for it. But it worked, and it was not that burdensome for the healthcare volunteers. And so it's something that we will continue beyond the pandemic, probably for years and years and years.
Definitely agree. We loved our staggered, so not everybody showed up at the same time.
Right.
And we did drive through. We did it at the high school, which was up the road, so they didn't even come to campus. And we did a rapid antigen test on arrival. We had done a PCR about 5 days prior and did a rapid antigen test on arrival. So we had a group of volunteers from my local pediatric hematology oncology nursing chapter who came to do the rapid antigen testing for us. So the medical staff could actually, while the test was cooking, they could do their medical check-in at the car. So that worked out really nicely and utilized the time really well. And we transported meds in just the big buckets back to campus. It worked really smoothly and we loved it. And so we're thinking for like our winter programs, probably moving it into the large high school gymnasium, which we can still spread out and disperse. But we like the fact that it's done off campus. And if somebody shows up and they screen positive or whatever, you just send them on their way.
While we're on this topic, again, coming from Canada, we have a different healthcare system and we don't have easy access to sort of paying for tests and things like that. And as of right now, even still, we can only really get tests when you're symptomatic. So we can't ask people to get tested if they're asymptomatic by the healthcare system. So I'm just wondering with you guys, whoever used tests, like what did that process look like, or what did your protocol look like? And also how did you get access to tests? And yeah, what was the process like with that?
I'm not sure if this is going to be helpful to you or not. I can tell you how we got it. In Texas, there was a program through the schools that had rapid tests, and they would, train someone at the school, not always a school nurse. It might've been an administrator and sometimes more than one person to be able to administer the rapid test. It's the Binax Now tests are the ones. I happened to be on the Texas Youth Camp Advisory Board with the state Department of Health and Human Services. And so I was like, hey, any way we could get camps into this program? And they did. And so camps could get cases upon cases of these Binax Now rapid tests that we, just could use as needed. And we still have cases of them. Maybe I should just ship you some. So it was a great resource. I don't know if you go straight to Abbott, which is the manufacturer of them, and said, this is what we do. Would they donate some? Maybe. I don't know. No, I'm saying no. Oh, you're on mute.
No, I was going to say the Binax Now is actually in short supply right now.
Okay.
So I don't know if anybody listened to the news right after everybody thought we were over COVID. And so Abbott actually they destroyed some of their supplies and some things like that because I don't think they thought they were going to need it. But anyway, more and more rapid antigens because of demand are not as easily available. I think they're trying to ramp up production again. Interestingly, I got my rapid, my Vinanex now for $5 a shot. Now they're up to, I think, 10 or 11. And that was a special discount because it was a camp. But we actually I looked at every option of running all of this by myself, like, ordering through Wisconsin, the free kits and all that kind of stuff. But then you have to do all the reporting and there's a lot of logistics with it. And just with kind of everything else we were trying to manage this summer, we actually elected to go through a healthcare consulting company who actually, they're based out of New Jersey and they kind of went into business, kind of helping people do weddings and all sorts of things. I actually went to an ACA thing on, testing through ACA New York, New Jersey. And that's how I contacted these people. And I talked to a lot of people, but I really liked this group because they're available to us 24 hours a day at camp. They're willing to be consultants. They got an ID specialist on their staff. I mean, we do have to pay them. I think I think we ended up paying about $50 a camper, but we did pre-PCRs, we did exit PCRs, and they ran submitted all my reports for me. They were available. We ran our screening through them. They had a screening tool that was just a quick click on your phone or computer. So we actually are going to continue our relationship with them because we had such a great experience and it just offloaded a lot of the paperwork. I still had to do the reports for them and put in results, but they took care of all the state reporting and all that, which allowed me to be more focused on the kids and the campers and the needs that they had at camp. So that worked for us. We did not have to pay through their submission because in the United States, pretty much anybody's been exposed to COVID-19 just by living. They didn't have one rejection from insurance company on the tests, either the pre or the exit. And then the rapid ones we paid for ourselves and we conducted those, but they submitted the results for us.
And on top of that, did anyone get any sort of like pushback from families or children? And did you test everyone regardless of age?
We did. We tested the pre one was a spit saliva. We thought that was easier to manage at home. We found a few people that couldn't get enough saliva to run the test. And so we had to do some work with them to get them into a local place to do an MP swab or an nasal swab. But we really the kids didn't seem to mind. I mean, would they rather not have had the nasal swabs? Yeah. But again, they knew that's what they needed to do to be at camp. I only can think of one kid that really wigged out getting his exit test done. But overall, I think it went pretty smoothly.
We required PCR testing prior to coming to camp. We also used a symptom tracker platform and required our families to use that 14 days prior to our first in-person event and 14 days post our in-person event. There were some that needed reminding, to go in and do it daily. I get it. But overall, everybody wanted to come to camp so bad, they were willing to do it. So it worked out fine.
I, will say that we had one father recently, not his son did come to summer camp. They did everything they were supposed to then, had signed up for a weekend, respite weekend camp and did not want to jump through the, hoops of getting their PCR tests and all of that, which in the US, as mentioned, it is typically covered by insurance. And if you don't have insurance, it's still free and all of that, which is great. The people at CVS have gotten to know me really well because they do drive-through PCR testing, and I do it, before every program as well. And, but this father said in an email, we will not be back at camp until the abusive practices of torturing children are, blah, blah, blah. It's like, okay, well, that's your choice. And, if we were not being as, if we didn't have our filters in place, we might suggest that you're abusing your child by, keeping them from all of the opportunities that could come, like vaccination and other protections. But anyway, so, yeah, we had one dad recently, but for the most part, families have been very cooperative, understanding, and eager to do whatever is needed.
I'm going to add to that, Brandon. My name's Erin. I'm with Camp Rise Above in Charleston. And this was our first summer doing overnight camps. And so, we had a lot more required of these, immunization forms and things like that. And obviously with COVID, there was, the screening forms beforehand and things. We actually got a lot more pushback about just regular good old vaccinations than I was anticipating. It sounds like, I bet a lot of you have already dealt with a lot of that over the years, but between that and our protocols for our staff and volunteers, which was, if you are fully vaccinated, here's the protocols. And if you are not fully vaccinated, here's the protocols. But we weren't like legally allowed to this summer ask. So it was kind of an honor system. And that turned into an issue with us. We had a staff person, like a paid staff person, who disclosed to me that she was not vaccinated and then did not want to do the protocols required of that. Because she felt like it would be singling her out, which is true, but not my choice. So it was, and she's no longer with us. And I think that's part of the reason. And so, and I hear some people are from Texas, South Carolina, sometimes any kind of stance on these things can be seen as political. And so we lost, one family, asked to be taken off of all of our information and things like that. But at the end of the day, I got to do what my medical team tells me is the safest for these kids. And if I want my camper that has cystic fibrosis or is in active treatment to come, because we have campers like Brandon with lots of different diagnoses, if we want to have a safe environment for those kids, which is the whole point, then we have to draw a line somewhere. So it did ruffle some feathers, but and it taught me a little bit more about how to have a little bit more of a backbone. So it was tricky though, tricky.
Where are people at with thoughts on mandating vaccines for 5 and up? I know you guys are a little bit ahead of Canada, but are most people thinking that they will be mandated like by next summer?
So I can say that for my camp, we actually have a meeting Thursday that we're meeting with our medical advisory team to really ask those questions as we get ready to launch summer applications for next summer in the next couple of months. And right now, my gut feeling is that we will keep the criterion that those who are identified as high risk by the CDC, which would include kids with cancer, at least those on active treatment with immunosuppression, that they would be required to be vaccinated to attend camp. So that's my gut on how that's going to go, but I might have more information after Thursday.
And I think our new policy is anybody who's age eligible for the vaccine, it will be mandated. And again, we're building out, we've had a pretty robust virtual arm that has been kind of the alternative to in-person, but now that we're going back, hoping to be more in person, we're looking at building out another arm of our programming that will be virtual. And so it may not be the same opportunity for them as in person, but they will still have the opportunity to attend camp in a different setting if they do not feel comfortable receiving the vaccination. As I explained to one mother who told me every reason why the reason they don't want their child to be vaccinated is because of a side effect that they had on the clinical trial for her treatment. And so therefore they don't want to do any of that. I just had to explain to her that I completely understood that and was empathetic, empathetic in my response as much as I could be, but I also had to explain that I had to look at the greater good for the entire community. So, I think that's what it's all about. We have a right to protect, an obligation to protect the majority of the kids coming to camp. And it's the same reason why we ask for them to be vaccinated against other things. And the AAP has a statement out, which I'm sure everybody has seen on general vaccinations, that they only really feel that a medical exemption is the only exemption that should be allowed for vaccinations at camp. But they also have a statement out that they strongly support the COVID-19 vaccine for anybody who is age eligible. So I kind of cited them a little bit too.
So I'll piggyback. We're in New Jersey, and we actually just met last week, the medical team and I, to talk about our 12 and up. Like, we already decided, staff, it's going to happen. We were a full virtual last year, but we just decided, staff, it's mandated. Then we met last week to talk about 12 and up. So now we already are planned, and we haven't even come to the full conclusion yet. But we're meeting again next week now. And I've added the 5 and up to our agenda. So, we'll keep people posted as well, but it's nice to hear what y'all have decided already. That's what I'm more leaning to as well. It's just mandating everybody.
Yeah,
This
I
is Al
think
Homans in Vermont. We're in the same situation that you are in New Jersey. I mean, the issue, of course, is even if the kids are vaccinated, if they're immunosuppressed, you don't know how much of a response they're going to have to it.
yeah, and the medical teams are only going to allow certain kids to get it, even if it is approved for 5 and up, right? Just like normal vaccines. So those kids on treatment might not actually be getting it anyway. But we're a little bit behind we haven't even officially approved 5 and up yet. So I'm just thinking that process, we're planning for next summer already, and that process hasn't even started yet. So, when is it actually going to start? And then it's going to take a number of months to get all of the kids vaccinated, right? So it's just a little bit tricky knowing what we can mandate when we don't even know if it's feasible for all of them to have been vaccinated by that point. Like, I hope that they would be, but it's hard to say, especially vaccinating small children. Like, it's a bit more tricky to do that than to do it like in a big gym somewhere or whatever. So yeah, just wondering where everyone's at.
Yeah, and we're also running into the one issue, since it was just, obviously opened up here. We're already running into issues getting enough vaccines to cover that age group. So, down the line, once we have everything out, once we decide if it's mandated or not, we're already short vaccines. So, we don't know if that's going to become an issue come the summer or actually the month leading up to the summer. Our camp is the end of August, but, we may run into that issue too. And then, did we mandate it, but now there's not enough vaccines to go around? Do we back, it's that tricky back and forth, the yo-yo, really.
And we're also in Canada, we're also just starting our 3rd doses for people who have already been vaccinated. So if you imagine that we need vaccines for everyone's 3rd dose, how will we also have enough for all children 5 to 12?
Yeah.
The beauty of the younger kids though is the dose is different. So they come from a different vial. So you have your adult dosing that is for 12 on up, but the 5 to 11-year-olds their dosing is taken from a completely different vial and smaller dose overall. So you won't be competing for those. I was hoping that the ACA would have a field guide for winter camps, because there's not a lot of guidance. It's kind of like summer camp's over, and so you can't even find, like on the CDC website, anything about camps right now. It's mostly about schools. Because I was looking to see if there was any updated guidance for, people who are running year-round camp programs. Maybe that's something we need to advocate for is because you're going to be indoors more. You're definitely, depending on the weather, you're definitely going to spend more time indoors and probably more time in masks than you did this summer because you were able to be outdoors more.
Susie,
while-
I'm sorry.
No, go ahead, Mary. Oh, all I was going to say is, while we wait for ACA, luckily enough, there's enough probably COCA camps in our membership that run those year-round programs.
Mhm.
I know Tecumseh, for example, they're running year-round, whether they're in person or virtual. I'm not 100% sure yet. I know they just did their virtual Halloween, or drive-through Halloween, excuse me. But I know there's a lot of programs that do run through the winter for a lot of our camps. I'm sorry, Mary Ellen.
No, that's okay. I was just going to mention that tomorrow, Tracy Gaslin's going to be with us, and she's the executive director of the Association of Camp Nurses. And she's also very instrumental in working with ACA to put out the guidelines for camps. So Susie, I think we need to ask her if she foresees a winter guidebook coming our way. If anybody would know, she would. So
Yeah, sounds like a
certainly
plan.
ask her. Mhm.
And we should definitely advocate with Tracy because she has the ear of certain people.
Yeah.
I will put that to some other people at ACA that I have connections with that might be able to help make that happen too, because it may be something that honestly they just hadn't really thought about. But when they have that aha moment of, oh wait, there is this whole sector of camps that run year round, then maybe that'll light the fire.
And probably a lot of those camps are special needs camps too. I mean, just because we're trying to find more opportunities for our campers. So yeah, Tracy's very responsive, and you're right. She does have the ears of the right people. So. But we use that field guide. I mean,
Yeah.
truly walked through that and, developed our guidelines, from that. And we had a 2-day retreat, just to come together and look at the guidelines to say, is this something that we think we can do for summer? And that really, every time there was a new addition, I sent it to my task force. And, but that really, truly kept you up to date. I don't know if anybody had a chance to hear Dr. Rafi's talk earlier today, but that was he did a great job in his presentation of really presenting the numbers and where we are and where things are going. And so if you didn't get a chance, I would definitely say take a look at that when it's available, because it was very well done. And he also talked about if you don't look at this unbiased SciPod, which is on Instagram. If you don't access that, it was recommended to me by somebody else, and I've been following it. But he really touted the benefits of everything that they post. He said they don't take any, basically bullshit is what he said, from anybody. They present only the facts, and they do really nice graphics and stuff that you can utilize when you're thinking about stuff or presenting to groups. So if you haven't taken a look at that, it's worth it.
Absolutely. That
What-
was very
what-
informative.
What was that, Susie? What was that you said
It's-
to follow?
Unbiased SciPod. And it's on Instagram.
Okay, sorry, I'm in the car, so
Nope, if you, I can send it to you, Deb. I'll just text it to you.
thank you.
Uh-huh.
We only have about 5 minutes left. Is there any other topics that we can hit on within that time frame? Anybody want to? If not, can you give me some ideas? We're going to be doing this again tomorrow night. So our roundtable number 2 will be tomorrow night, and would love to have some ideas so that we can kick off with what you want to talk about. So if you have any suggestions or topics you'd like to begin with, we can certainly do that as well.
I know this is more programming, but it sort of fits into the mental health thing. For some of us who've been in virtual for 2 years, we have like 2 years of graduating classes. And I don't know if anybody's thought about, we're thinking about, can we pull them back together for a leadership or for a retreat/leadership thing? How do we, they kind of missed all of that transition that we try and pour into them. So I don't know, it may not fit with this group, but it was just a question.
We did grandfather kids in this summer, Deb. We obviously didn't have 2 years, we just had 1 year, but we did extend and allow those kids that should have graduated the year before to come to the summer camp.
And you guys didn't have any issues with them, because some of them are going to be counselor age now. For
We
us,
didn't have
that's
any-
one of our issues.
Yeah, we didn't have any issues, but I actually like the idea of maybe just a retreat for like the older kids together,
We did we were hoping obviously to be in person the second year, but so I gave everybody who was supposed to graduate from the camp and our LIT program an extra year in the program. And then of course we went virtual again. So what we did was we did graduate all of our campers. We had a special ceremony at the end of our virtual week, but what I did was I changed the requirement to go into our LIT program so that those kids could come back as LITs. They didn't have to take an additional year off to give them that time. My LITs, my leaders in training that did graduate, there were only a few of them at that point. So we had a special, basically I had a barbecue at my house because we were outside, so everybody could spread out in the backyard and kind of had like a little get together, only because they live near me. So it worked out nicely. But our goal was to do something in person for them since there were so few of them. But I did, as all of you probably would imagine, I did check their vaccination cards and everything before they arrived to my house. So then we made sure that they were all taken care of. But, I had a few campers that have reached out and said, can I come back? And obviously because of the pandemic and everything, we are taking a case-by-case basis. Our campers do go up to the age 18. We don't graduate our program till 18, and then our program for our LITs could span between 19 and 21, and then our counselors start at 22. So depending on their age as well, we'll give them the extra year. If not, then they'll just have to apply to be LIT or staff at that point. So there's only so much, holding on that we could do for them. We'll do our best, but.
Thank you. Those are helpful insights.
I can say, and again, we serve a different population than most COCA camps, but I guess we don't have that many campers who do graduate. So many of our campers have intellectual disabilities, and we take campers up to age 50 as first-time campers, and even beyond 50 if they've been coming for the past 41 years and still need camp, and we can manage their health needs and at age 55 or whatever. But where we have kind of struggled more with those kinds of issues is we had such a hard reset from not having the continuity of having camp in 2020, and losing touch with our staff and volunteer base and healthcare volunteers too, that it's just been a struggle to get them, to get people re-engaged. And we also depend a lot on teens and young adults. Because those folks, grow up and get big people jobs and do other things that are developmentally appropriate for them, we are always, trying to recruit new folks. And it's been a real challenge, because our best recruiting method has always been word of mouth. Somebody comes, has a great experience as a volunteer, they go and tell a couple of friends and they bring them back with them. And by taking the hard pause in 2020, we just lost some of that inertia and are still struggling to get that back. And again, it cuts across all of our areas. And I think for healthcare volunteers, the thing that has been hardest about getting them back engaged, because we do have a lot of returning healthcare volunteers from year to year, but it's that their jobs didn't let them. Their jobs said, no, you can't go, that's too risky of an environment, or whatever it was, that we just have struggled to get licensed health professionals. We've got nursing students out the wazoo because they need experiences. And so, for pretty much every session of summer camp last summer, we had 10 nursing students every week. And, they're great things that they can do, but there are things they can't do. So getting those licensed professionals is definitely something that we're still working on, getting them re-engaged.
I've also seen a lot of nurses that I've been using take travel jobs. They're kind of, done with the unit that they're on. They can make a ton of money. I mean, the salaries that they're being paid per hour to go work. And a lot of my, go-tos are no longer around because they're doing traveling jobs. And I think the other thing I'm seeing with the winter camp is it falls 27th of December through the 31st is people don't want to spend time at camp this year. They want to be with their families, and I don't blame them. I mean, they've got maybe some time off and they want to get re-engaged with the people they haven't seen on a regular basis. So it definitely is a struggle.
Yeah, and I don't think just from the forecasting and then what's happening, at least in the hospital setting, I don't see that changing in terms of trying to get nurses. So I've talked to some of my retired professional organization buddies about thinking about camp for this summer for those of us who are in compact, like with their license as a compact licensure. So thinking outside the box for us, because it was always the nurses from the unit that took care, or the clinic that took care of the kids that would be our staff, our nursing staff.
So Deb, look at nursing professors at your universities too. I've got a few of those.
Oh, that's a great idea. Thanks, Susie.
Yeah, I have heard, I don't know many camps that can afford it, but I have heard of a few camps that have hired travelers to do, if they're running a full summer season, if they're running June, July, August, or whatever, just hiring a traveler for that term. But man, does that cost a lot of money. And then I've also heard some working on a strategy of getting people who are doing traveling but are willing to commit to that time frame for less, so that it's not officially through their traveling company, but they just take a break in their travels and come spend it at camp. Again, I don't know exactly how you reach those people. The greatest thing of all would be if, you know, we had some sort of partnership, and maybe this is a strategy that we all need to work on, a partnership with one or more of the travel nursing companies, where they say, you know what, we value what you do. And even if it's just like 1 week or 2 weeks of sort of an intercession between their travel assignments, if they would give them some sort of incentive for doing it, maybe it's not pay, maybe it's they come and volunteer for a week, but maybe there's something that the travel nursing company could do that, you know, maybe guarantees them their first or second choice instead of one of their 3 choices. But, you know, like, I don't know. If you don't dream it, it won't happen though.
So true.
There's also something called volunteer match. I don't know if anybody's used that for recruitment, but there was a lot of, we had a medical advertisement on that. The only thing tricky with that is that you have to look at your compact, you know, licensure stuff and whether or not they fall within your state. But that actually, there was a lot of people who inquired through that, looking for opportunities to give back. And so I have had some steady nurses, and they're willing to come from Tennessee and different places, you know, to come to camp. So that might be another thought. And we took down our ad because we really didn't have, you know, there was that 1.5 years where we didn't have anything. And then we just really weren't interested in brand new folks coming our first year back up and running. So, but that's maybe something we do again.
I also recruit, because, you know, camp never stops. I've actually recruited 2 of our school nurses. I work in a school system, so I actually was able to get 2 of our school nurses willing to volunteer. My incentive was that since we're based in New Jersey, but our campsite is in Pennsylvania, so all of my nursing staff have to be certified in Pennsylvania or have, so we are willing to, our camp pays for their temporary license for the state of Pennsylvania. So that's our way of getting them. So I picked up 2 school nurses. That might help if folks want to try to hit up some schools. They have the summers off.
It's a great idea. Great idea. Okay, well, thank you so much, everybody. I don't want to keep you longer because I know everybody's got to get some dinner, and then we're going to come back for our next session. I think it starts at 8. I just want to thank everybody for participating. Thank you so much for the great ideas and the information. And thank you for your willingness to just share your insights and dreams and goals and things like that. Again, if you have any suggested topics for tomorrow night, feel free to shoot me an email. Be happy to kind of facilitate that in there tomorrow night. And if not, I hope you guys have a great evening. Don't forget to fill out your eval, okay? Because there are CEUs available for this session. And we'll see y'all in a little bit, not long.
Mary Ellen, let me ask you a question if I can, because maybe other people haven't, maybe other people have already got it answered. But I know that eval kind of contains all the sessions. Would you rather us try to keep it open in a window and then just submit it once at the very end? Or do you want, should we submit it each time we do a session?
Whatever's easiest for you. If you want to do it all at one time, that's fine too. You know, whatever's easiest for you is fine. We'll make it work. We'll make it work.
Okay.
Okay.
I just figured one way might be easier for you if it was all in one survey instead of having to compile it from many different ones.
No, it's okay. Either way, I'm good. I'm good with either way. I just appreciate you filling it out. I do.
Well, we appreciate you and Teresa doing all you do to make this happen.
Well, thank you.
A lot of work, and we're very grateful.
It is, but it's worth it. It's worth it. All right, guys, we'll see you in a couple hours. Okay.
Thank you.
Bye.
Thanks, y'all.
Bye.